Greetings, this is Matthew stepping in for Diva, and it's great to have you back on our channel. Today our spotlight is on ocular rosacea, what it is and the ways we can manage it. So let's dive straight in. So, how does ocular rosacea make its presence known? Ocular rosacea can be quite the shapeshifter, presenting itself in a variety of ways, and the symptoms can vary greatly from person to person. The most common sign is, of course, redness in the eyes. This isn't your typical, I've been up all night binge-watching my favorite series redness. We're talking about a persistent, uncomfortable redness that often comes with an unwelcome sensation of grittiness, like there's a tiny speck of sand lodged in your eye. Dryness is another frequent symptom. Your eyes may feel as parched as a desert under a scorching sun, leading to irritation and discomfort, and then there's the sensitivity to light, known as photophobia. Bright lights, whether from the sun or a computer screen, can cause a nigh unbearable stinging sensation. Now, imagine having to deal with inflamed eyelids, a condition known as blepharitis. This can cause your eyelids to become swollen, red, and crusty. Not only does it affect your appearance, but it can also lead to a feeling of heaviness around the eyes, making it a struggle to keep them open. Sometimes, ocular rosacea can also lead to styes, those pesky, painful bumps on the edge of your eyelids. And in severe cases it may even cause a loss of clear vision, a condition known as keratitis. This occurs when the cornea, the clear front surface of your eye, is inflamed, leading to blurry vision, and in extreme cases, vision loss. Let's not forget that ocular rosacea can also affect your tear and oil glands, leading to abnormal tear production and quality. This can result in a condition called dry eye syndrome, which can make your eyes feel itchy, burning, or like they have something in them. As we can see, ocular rosacea can really affect a person's daily life. But what causes it? Let's delve into that in the next scene. What causes this red-eyed beast to surface? Ocular rosacea, an inflammatory eye condition that often accompanies the skin disorder rosacea, is a bit of an enigma to medical experts. The exact cause of ocular rosacea remains unknown. However, several potential triggers are worth noting. First up, we have environmental factors. It's no secret that our surroundings can have a profound impact on our health. In the case of ocular rosacea, things like extreme temperatures, wind, and sunlight can trigger or worsen the condition. So, if you're out and about on a particularly sunny or windy day, your eyes could be at risk. Next, we have lifestyle factors. This includes a range of things, from diet and alcohol consumption to stress levels. Some studies suggest that hot beverages and spicy foods can trigger rosacea symptoms. Alcohol, especially red wine, has also been linked to flare-ups. And let's not forget about stress. It's a common trigger for many health conditions, and ocular rosacea is no exception. Then, there's the role of microorganisms. Certain types of mites and bacteria could potentially contribute to ocular rosacea. For instance, an overgrowth of skin mites known as demodex might be involved. These microscopic critters are usually harmless, but in large numbers they can cause problems. Lastly, let's touch on the genetic factor. Like many health conditions, ocular rosacea often runs in families. If your parents or siblings have rosacea, there's a chance you might develop it too. The mystery of what exactly causes ocular rosacea is still being unraveled, but understanding these potential triggers can help manage the condition and keep the red-eyed beast at bay. Remember, our bodies are complex systems, and what affects one part can often impact others. In the case of ocular rosacea, it's a mix of environment, lifestyle, microorganisms, and genetics. Now that we understand the causes, it's time to look at how to manage this condition. Before we move on to discussing how to manage this condition, we wanted to take a moment to say, if you're finding this video helpful, don't forget to like, share, and subscribe to our channel. It helps us to continue producing informative content like this. Don't forget to hit that notification bell so you'll never miss an update from us. We appreciate your support in growing this channel. Now, let's move forward and talk about managing ocular rosacea. So, how can we tame this red-eyed beast? Taming ocular rosacea is not a one-step process. It requires a combination of treatments and lifestyle changes. Let's dive right into it. Firstly, we have medical treatments. Topical medications such as antibiotics or corticosteroids may be prescribed to reduce inflammation and redness. Oral antibiotics like doxycycline can also be used for their anti-inflammatory properties. In some severe cases, surgical procedures might be recommended to alleviate discomfort and improve eye health. Remember, always consult with your healthcare provider to choose the best treatment for your condition. Now, let's talk about the importance of eye hygiene. Regular eyelid care, such as warm compresses and gentle cleansing of the eyelids, can go a long way in managing ocular rosacea. These practices help to reduce the buildup of bacteria and mites that can worsen inflammation. Moving on to lifestyle changes, certain triggers can exacerbate ocular rosacea. These may include hot or spicy foods, alcohol, stress, and extreme weather conditions, among others. Identifying and avoiding these triggers is a key part of managing this condition. Nutrition also plays a crucial role. A diet rich in omega-3 fatty acids found in fish like salmon and mackerel can help reduce inflammation. Additionally, staying hydrated and limiting caffeine intake can also assist in maintaining eye health. Let's not forget about the importance of protecting your eyes from the sun. Ultraviolet rays can cause flare-ups, so wearing sunglasses and hats when outdoors is a good practice. Lastly, regular checkups with your ophthalmologist are essential. They can keep track of your condition and adjust your treatment as needed. In conclusion, managing ocular rosacea is a holistic process. It involves medical treatment, maintaining eye hygiene, making lifestyle adjustments, and regular checkups. It might seem daunting at first, but remember, every small step you take contributes to a larger leap in managing this condition. With the right treatment and lifestyle changes, managing ocular rosacea is possible. What does living with ocular rosacea look like? Imagine waking up in the morning and the first thing you feel is a gritty sensation in your eyes, as if you've slept with your contact lenses on. Or, consider the discomfort of dry eyes in an air-conditioned room, but it's a feeling you experience throughout the day, every day. That's a glimpse into the daily life of someone living with ocular rosacea. This condition can be more than just a physical ailment. It can also affect people emotionally and socially. The redness and swelling can lead to self-consciousness, causing a desire to withdraw from social situations. It can be challenging to maintain eye contact during conversations, which can lead to feelings of disconnect or misunderstanding. The discomfort can also affect concentration and productivity at work or school. But life with ocular rosacea is not just about managing symptoms. It's also about adapting. People with this condition learn to incorporate necessary changes into their daily routines. They become more mindful of their environments, avoiding triggers such as strong winds, sunlight, or harsh indoor lighting. They learn to take frequent breaks when doing tasks that require intense focus, like reading or using a computer, to rest their eyes. They also maintain a strict eye care routine, which may include using eye drops, warm compresses, and eyelid cleaning techniques. They work closely with their healthcare providers to manage their condition, regularly updating them on the effectiveness of their treatments and any new symptoms. Living with ocular rosacea also means becoming an advocate for one's health. It involves educating oneself about the condition, staying updated on the latest research, and connecting with others who are going through the same journey. This sense of community can provide much-needed support and encouragement. Ocular rosacea might be a challenge, but with knowledge and the right approach, it can be managed. Remember, it's not about the condition defining the person, but the person defining how they live with the condition. With resilience, patience, and a positive outlook, one can lead a fulfilling life even with ocular rosacea. So, let's summarize what we've learned about ocular rosacea. This condition is more than just a red eye. It's an inflammatory disorder that can cause discomfort and vision problems. We've learned to recognize the symptoms, which can range from dry, itchy eyes to blurred vision and swollen eyelids. We've also delved into the potential causes, which include environmental factors, genetic predisposition, and certain bacterial infections. We've explored various management strategies, including regular eye hygiene, medications, and lifestyle changes. Living with ocular rosacea can be challenging, but it's not insurmountable. With the right knowledge and strategies, you can manage this condition and maintain a high quality of life. The journey to understanding ocular rosacea doesn't end here. Continue to educate yourself, consult with professionals, and keep up with the latest research. Again, this is Matthew sitting in for Diva. Thanks for watching.